Does back pain last forever is a common asked question, and it really depends on what tissue was injured during the event. If you're injuring a muscle, for instance, a strain to a muscle, muscles have a fair chance of regenerating and healing properly and not returning. If you break a bone, bones, if they're diagnosed correctly and treated correctly, they can also heal very well. They have good blood supply, and you can get out of trouble and not have a return. The problem is that most of the patients that go to physical therapy are dealing with a soft tissue injury, meaning the joint capsules of the spine have been damaged, or the disc has been degenerated, or the disc has been damaged. And the reality is those tissues do not regenerate. They're soft tissue, they're not muscle, and like a tire on your car, once it starts to wear, you have to either replace it or you're going to get a flat. Well, in the spine, we're not going to replace these tissues quite frequently. So you're really left with some damage to the tissue. It can heal in terms of the pain can go away or reduce, but the tissue itself is still inherently damaged, and the recurrence rate, therefore, of back pain is very high, over 80%. It's recurring in nature. So you can have these episodes, you could feel good from time to time, but unfortunately it will rear its ugly head again. Now, with the proper management of a soft tissue injury, you can reduce the pain and manage it with some fair amount of success, but it's very tricky and it often requires a very skilled clinician to achieve that goal. So does back pain last forever? Well, technically yes, if we're not treating it right. How bad depends on what you're doing for it.